Welcome back. It's Dr. Jennifer Boney, better known as DocJenFit, Doctor of Physical Therapy, and founder and creator of Gen Health Movement Platform for all things aches and pains that might be happening within your body. And today I want to take you through a core workout that you can do, especially if you're starting to feel any sciatica symptoms or one-sided pain in your back, maybe into your glute. I want to tell you what you can do to help support the stability within your trunk to help reduce the symptoms that you're feeling out into your low back, hips, and legs. So we're going to start onto our back. This is really going to be the foundation of core work. Sometimes we skip right to like these really advanced exercises, which is dead bugs. Dead bugs are quite advanced. If we don't have that core foundation of what's happening within our inner core from our pelvic floor to our diaphragm before we start expanding on these bigger exercises, which we might not even think dead bugs, that's easy. Not quite. So let's take it back to the basics, slowly build it up, and then I'll show you what you can do after that as well. So we're going to come to our back. Now, I'm pregnant, so, I am not going to have this flatness in my belly as I work on this contraction, but I'm going to talk you through what you should be feeling within your body, okay? So right away, we want to think of breathing from this low rib cage area. So I want to kind of take a little squeeze onto the sides of the rib cage and then breathe into your hands. So it's not just a belly breath, but it's really, can I expand from this rib cage? And then exhale and think of pulling like an elevator is lifting up into that pelvic floor and I'm squeezing those hip bones together. The rib cage might drop, but we don't want it to think of dropping only from the rib cage. So again, from that inhale, exhale from the bottom. Again, inhale from the top. Exhale. Other cues from that pelvic floor is like you're thinking if you have a vagina, you're thinking of picking a blueberry and pulling it up and squeezing it in. Okay. If you have testicles, you are walking into really cold water and they pull up and in. So it's that lift and squeeze. It's not just a squeeze, but it's a lift feeling that we want to have within that pelvic floor. And then a contraction from hip bone to hip bone, almost like when you laugh and I put my fingers right on the inside of those hip bones and I laugh. And this is always so silly because, not a genuine laugh right now, but if I laugh, ha ha ha, there's this tightening that's happening on the inside of my hip bones. Okay. Those are your obliques, but also our transverse abdominis underneath that we want to start to feel engaging. Now, as we do this, what you also want to notice is that I'm not forcefully dropping my rib cage. I'm not forcefully tucking my tailbone and I'm not squeezing in my glutes. Okay. Your glute should be relaxed the whole time and there should be no movement in the pelvis and not much in the rib cage except for maybe a slight lower of this rib cage. Okay. So again, let's practice one more time. Put those hands on the rib cage, breathe into them, breathe out from the bottom. Hold that, breathe in for the rib cage. And just it's not going to be any more of a pull. It's just going to be holding this foundation. Breathe in and hold. So can I hold and maintain this position as I breathe and as I move? That's going to be our challenge. So completely relax everything. You should feel the difference between relaxation and tightening. Now we're going to combine some movement. So breathing in, breathe out. Hold that positioning. Breathe in as my knee falls out to the side, making sure my hips don't move. Breathe in, breathe out. Hold that stability. Breathe in, breathe out. Nothing is moving in my hips. No movement in my trunk. One more. And relax. Try it again. Breathe into the rib cage. Breathe out from the bottom up. And that knee falls out. No movement in my hips. Breathe out. Breathe in, breathe out. In, out. No movement. In. One more. Now we're going to try the same thing, but my foot is going to slide out. So my heel is going to gently slide as I breathe in. Breathe out. As I breathe out, I want you to think of that kind of pull from that pelvic floor region. Okay. So it's not just my hip flexors now. My hip flexors are working in combination with my core. So again, breathe in, out, contract and hold. Breathe in. As it slides out, breathe out. Again, in, out, in, pull low, and try the other side. Hold that contraction. Breathe in, breathe out. In, out, in, out, in, out. One more, in and out. Now we're going to start the work of a dead bug. So completely relax between exercises so you can feel what that relaxation and that contraction feels like. But we're going to just start with marching. So it's one leg coming up and then the other leg. Now the difference is we're going to be completely contracted into that trunk area, just like we were before. Breathing in from that low rib cage. Breathing out low. Feel that lift and that squeeze. Hold it. Still breathing from that rib cage. Now, as I lift my leg, I'm going to push with my opposite arm across. So I'm getting a little bit more into the obliques without rotating or moving my trunk. It's going to look like this. Breathe in from my rib cage. Breathe out. Pull it. And slowly place it down. Nothing is moving in my trunk and my hips. Slowly press it down. 2. Make sure that so feel in this midline. As you press, there's no lift to your fingers. You want to compress down lower. Really breathe out. Exhale those abs down. Inhale from the rib cage. Exhale down. Exhale down. Good. Then we'll sit up. So that is like the start. Before you even master and get to a dead bug, you should master those exercises. Now I want to do it with, now it's kind of a modified plank position. It's in quadruped. So I'm on all fours. I'm going to press the ground away from my fingertips. So I really want my fingertips active here. My forearms are active and I'm unlocking in my elbows. So I'm not resting into my elbows. It's going to put a lot of tension into my wrists. So unlock your elbows, press into the ground from your fingertips, and think of pushing the ground away like you're going to push that sternum or that chest away from the ground. I'm not rounding. I'm just pushing away. Okay, that's automatically going to help to bring stability through my trunk by using what's called my serratus anterior around my shoulder blades. Now from here, I want to inhale, just like we did before around that rib cage. Exhale the same way we've been doing. Holding that, I can still breathe from my rib cage. And I contract it even more as I hover in my knees and I hold 5, 4, 3, 2, 1. Come down and try again. Inhale, exhale it up. Still breathing as you're up. 5, 4, 3, 2, 1. Come down. Inhale, exhale it up. Push away from the ground. 5, 4, 3, 2, 1. Slowly place it down. Inhale, exhale, lift. 5, 4, 3, 2, 1. Last one. Inhale, exhale, lift. 5, 4, 3, 2, 1. Now to make it a little bit more of a challenge, getting that hip mobility with that core, I'm going to be in that hovered position, but I'm going to allow one knee to drop to the ground, come back to that hover, other knee to drop. So I'm going to be shifting in my hips. What I don't want is a shift all the way through my trunk. I want to think of reaching from my hip bone and coming out. So it's going to be more from my hips rather than my low back or trunk. So it's going to look like this. We're going to press the fingertips away, press down into the ground, hovering. I'm going to reach one knee and then come up. Other knee, up. 2, up. Breathing from that rib cage, up. Holding that core, up. A few more. Tap, up, tap, up. One more. Tap, up, tap, up. So we're getting a little bit of core with that hip dissociation, trying to work on really increasing that stability and core with a little bit more mobility through those hips. Now, if you're feeling a lot of sciatica symptoms, you feel like you need a little bit more mobility or your nerve needs a little bit of attention, we have videos on both of these. And if you liked, kind of these core cues, coming back to the basics, understanding it before you progress, I highly recommend our core plan on Gen Health. Now, you can try a week free completely of this, but I'm going to give you a lot of these cues to understand what's happening deeper so that you turn off the dominance from those hip flexors and their quads, so that your low back isn't feeling any tension in your planks, so that we're understanding how to utilize our obliques with our transverse abdominis and how everything works together. And you'll go through a 30-day plan and then progress to another phase where you're really going to bump up the core work and how that all works together to create this trunk system. The core movements aren't going to be all about stabilization, but about rotation and movement and using bands to kind of help and build in this core capacity from our shoulder blades all the way down to our hips. So I hope that you check that out. It's a great place, especially if you're feeling a little confusion around the core or you're noticing a little coning and doming and that abdominal region as you're doing advanced core exercises. We're going to take you back to understand your body and help you progress safely and effectively. Don't forget, if you love what you're learning, I have so much more in stock for you. So hit that subscribe button, check out the other videos I've done in the past, and leave any comments of any suggestions that you have for videos in the future. And I can't wait to help you feel incredible and amazing within your body.